Promoting Homeopathy is conducting regular webinar since last 1,338 days. And we have 3 sessions in a row. And the first session is already over today. And that was our Hindi session from 7 to 8. And 8 to 9, we have an international session in English, and 9 to 10, local language session in Malayalam. All these days, we have the guests from different parts of the world, and particularly doctors from 65 countries have presented different subject papers in this forum, and we are lucky to have a wonderful person in Mridul Kumar Sahani sir. Sir is able to bring the best and eminent doctors from India as well as other part of the world also. So our forum is growing day by day with a lot of good presenters. And today we are lucky to have one young doctor in Dr.VAIDEHI BHATT. He has completed MD in homeopathy and is working as an assistant professor in Rajkot Homeopathic Medical College in the Department of Homeopathy Pharmacy since 2019 as 16, and that means she has nearly 7 years of very good experience in that teaching area, as well as she is working as a clinician at Sainath Homeopathic Hospital attached to Rajkot Homeopathic Medical College, Ram Rikoshi Charitable Trust Homeopathic OPD, and owns her own clinic at Vaidic, the True Healthcare. She is a very good administrator, and she has a very good training exposure, and she has presented various papers in international as well as national journals, and as a resource person in Trust Prasar Bharati, All India Radio, Doordarshan, and Health Program of Nirmay on topic child obesity and homeopathy on 29th April 2023. And she has published so many research papers in clinical and experimental homeopathy on mother and child healthcare with homeopathy, management of postpartum depression with homeopathy, and so many papers. I'm not elaborating all those things because you can get all those things through our posters. And she has achieved a research presentation in Ayush India Expo 2018 on the topic of management of postpartum depression with homeopathy under category of mother and child health care. As a resource person in webinar series Homeopathy 360 in collaboration with All India Homeopathy Students and Youth Association. And she has extracurricular, she managed cultural first teachers a day, Women's Day, etc. And the college participated in different and drawing essay writing competition exercise in the college, and she has a membership with alumni cell Rajkot Homeopathic Medical College and Readers Club, etc. And she has already presented some 2 to 3 papers in our forum earlier. So today, Dr. Vaidehi Bhatt is presenting a paper on discomfort of harmony. As you know, when the harmony is deranged, you may feel a discomfort, and homeopathic insight into the pain management. This is one of the area where homeopathic doctors can do wonders. And so we can proudly welcome our beloved guest, Dr. Vaidehi Bhatt, to this session. Welcome.
Thank you, Danesh sir, for the introduction. Thank you, Sahani sir, for inviting me again on this platform. I am lucky to got the second chance in this platform. Thank you so much, sir. Good evening, all of you present for today's session.
Visible. Everything's fine. You can go ahead.
Okay, sir. Sir, my screen is visible to everyone.
Fine.
Okay, sir. Thank you, sir. change me. Just a second. Okay. So today's my topic is discomfort to harmony, homeopathic insight into pain management. So everyone knows when patient is suffering with the pain, they says death does not scare me, the unbearable pain does. I just pull my hair apart and wish I could die. So if we describe the definition of pain, it is described by the International Association for the Study of the Pain, an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Described in the terms of such damage, we know this condition as pain. So if we observe the epidemiological statistic, more than 20% of adults globally suffering with the pain and 10% are newly diagnosed with the chronic pain each year. So prevalence of the pain in a patient in our PHC in central India is around 29.63%. It's almost 30%. And prevalence of chronic pain among these patients are almost 20%. So it is predominantly observed in a female and mostly in a age group of 21 to 60 years, means childbearing age to menopausal age. And prevalence of the chronic back pain was highest. It's almost around 24 to 84%, means around 25%, followed by body pain, knee joint pain, chest pain, upper limb pain, and pain in a various area is less than 10%. So these are the just tip of iceberg that we got from the epidemiological statistic. Number of patients suffering with the pain is much more higher than this statistic. What are the types of pain we are observing in our OPDs? So if you can able to watch on left side of the figure, there are various types of pains: sharp, shooting, steep, pressing, lameness, burning, and sensations described by the patient, that is cutting pain, stitching pain, pressing, pricking pain, stinging pain, lancinating pain, twisting pain, band-like sensation, squeezing sensation, and sensations like bone is broken as if it is sprained, paralytic pain. To various type of sensations are there. And if we are observing the figure on the right side, so there are frequency of the symptom: constant pain, recurrent pain, remittent pain that comes and goes, then tension pain, spasmodic pain. Sensations are different with the pain: paresthetic, numbness, stiffness, deformity, pain associated with the tremors, discoloration of the area, swelling, weakness, restlessness, and atrophic changes. So if we are go through the various classification of the pain, first of all, based on the underlying pathophysiology. So then first is the nociceptive pain. This originally originate from the response of the noxious stimuli. Characteristic are like sharp burning pain, dull aching pain. And moreover, we are going to observe this type of pain in case of back, head, neck, shoulder, and it is mostly observed after the burns and after injuries. Then neuropathic pain, so central sensitization or neuronal damage, having a severe burning pain, shooting, numbness, and there is the increased sensitivity of the stimuli, which we are going to observe in case of peripheral neuropathy, maybe caused due to B12 deficiency or maybe caused due to diabetic neuropathy. Then trigeminal neuralgia, complex regional pain syndrome, then neuropathic pain due to the spinal injury. Then mixed type of pain, that is nociceptive and neuropathic. Both type of pain combinedly observed Then in this condition, character of pain will be like severe shooting pain or dull aching pain or pain with the mixed characteristic. So lower back pain associated with the radiculopathy or cancer pain, we are going to observe this both type of pain combinedly. If we are going to say the based on the duration, then we can describe it under the acute pain, chronic pain, or breakthrough pain. In acute pain, there is the activation of the peripheral nociceptors combined with the enzymes and prostaglandins that last for few seconds to less than 6 months. And it is followed by the injury, it is followed by the sprain, post-operative pain, back pain, and headache. Next is the chronic pain. So sensitization at the level of spinal neurons via multiple mechanisms. This pain will last for more than 6 months. So it is due to the chronic primary pain, cancer pain, post-traumatic pain, post-surgical pain, neuropathic pain. Now, we will observe in case of abdominal surgery or after the LSCS, mostly in a backache, headache, orofacial pain, visceral pain, musculoskeletal pain, and back through pain. As we know the meaning of back through, if someone is taking treatment for a certain type of pain, so after the stoppage of the medicine or beginning of the treatment or the exercise or physiotherapy, so after the beginning of the drug effect, this pain will start that last for few seconds to hours, and it is also observed in case of cancer pain. Next is it based on the etiology. So first of all is cancer pain. So caused due to the cancer itself, maybe brain tumor, breast cancer, drug treatment, chemotherapy, radiation, or it is always associated with the neuropathy. And characteristic of pain like acute chronic pain, mild, moderate, or severe intensity with or without back-through pain. So it will observe in case of all types of cancer. If we are going to observe the known cancer type of pain, then it may have multiple etiologies. Pain may be mild, moderate to severe pain without restricted of with or without restricted mobility. That is commonly observed with the patient of arthritis, rheumatoid arthritis, osteoarthritis. Patients suffering with the chronic psoriasis will suffer with the psoriatic arthritis. Then, based on the location, low back pain that is most commonly observed in our OPDs also. It is caused due to the bad posture. It's the commonest cause of backache, strains, sprains, underlying disease like malignancy infection, or referred pain like a patient having a renal stone or gallstone, they having a renal angle pain or gallstone pain on the right side of the back. Then characteristic of pain will be like mild to moderate to severe pain with or without impaired movement or physical function. As for example, acute low back pain or herniated discs and spondylotic changes, especially in the low back than after the cervical pain. Neck pain and shoulder pain, it is common after the lower back pain. Now, mostly we are observing it in a female as we showed in epidemiological cases. So cause of neck pain and shoulder pain is it is caused by the strains, sprains, incorrect posture, or compression of spinal cord and injuries. Then characteristic of pain will be like mild and moderate to severe pain with or without impaired movement or physical function. Mostly it is observed in a axial neck region and cervical radiculopathy. Then the headache caused due to incorrect posture, stress, migraine, or underlying disease condition, maybe tumor related with the cerebellum. Then headache is associated with the migraine may present additional symptoms like aura, then nauseating sensation, visual problems, vertigo, and tension type of headache and migraine headaches are very much common. Then referred pain. So type of visceral pain that radiates to surrounding region, maybe sharp, pulsating pain or dull, aching pain, depending upon the origin, like inguinal pain, which refer to jaws and shoulder, stone, abdominal, back, that renal stone pain or gallstone pain or bladder stone pain, ureteric stone pain, will pain referred to abdomen and back. Next, what is the mechanism behind this pain? Basically, pain is a protective mechanism of the body, and it actually gives the warning to the sufferer to withdraw the distracting stimulus. Then most of the pain resolves by the removing such noxious stimuli. If you remove the cause, then you won't suffer with the pain. Then the distress that arises by the pain are lack of attention in a work, reduced mental flexibility, inability in information processing, anxiety, depression, fear, anger, etc. So it is one of the major causes which may drastically reduce the patient's quality of life. So there are so many medical conditions in which managing pain is challenging to the practitioner, like pain in a cancer, chronic post-operative pain, advanced osteoarthritic pain, trigeminal neuralgia, and various psychogenic pains, breakthrough pains in a different conditions, etc. So in most of the cases, the underlying pathology is very difficult or impossible to remove, and thus the pain management becomes necessity. So although these challenges are encountered by the various specialty and super specialty, but most of the cases appears to be refractory to the medication. That's why a separate super specialty called pain medicine has been evolved in the medical province. So what is the pathophysiology of pain? So regardless of its categorization, pain cannot be distinctly attributed to any isolated pathological event. So pain experience is the complex process that involves the activation of multiple neuronal signaling pathway within the peripheral nervous system and central nervous system. So subjective experience of the pain may be summarized as a 4-stage. This process are transduction, transmission, modulation, and perception. So what are these 4 stages? First, transduction. So if nociceptive stimuli of the tissue damaging potential, which may be including a mechanical, chemical, or thermal stimuli, are converted by the sensory cells into the action potential. Then the stage 2, that is the transmission, that involves the conduction of this action potential along afferent neurons to the DH of the spinal cord. Then the stage 3, that is the modulation, that coding of this non-receptive information occurs at the level of the spinal DH. Modulation at the DH can be excitatory or inhibitory. So thereby increasing and decreasing that will be resulting in pain. Then the stage 4 involves the generation of the autonomic, affective, cognitive, and behavior responses to the pain stimulus, leading to pain perception. So to transduction to involves generation, patient will start feeling this pain. What is the need for individualized pain management? An individualized perception of pain may be greatly influenced by the emotional and behavior responses and is strongly correlated to his or her culture, personal history, and genetic makeup. So, for instance, presence of different hypotypes or catecholamines or methyltransferase gene has been linked to variability in pain perception in humans. Thus, treatment for the pain must be tailored for each individual and should focus on the interpretation of reinforcement of the pain behavior and modulation of the pain responses. So, important factors for the consideration for the treatment and recommendation includes individual response to prior appropriate treatment management, compliance, and drug abuse and dependence behavior. So psychological model of pain encompasses the biological, psychological, and social aspect of the pain that has been increasingly used in a variety of chronic pain setting. This will be useful in treating a patient's chronic pain. Then we have to observe the behavioral aspect and psychological aspect along with the physical characteristic of pain. Since the experience of the pain is heterogenic in nature, one size fits all approach would not be most ideal way to manage the pain. In short, an individualized approach to treatment based on the genetic, cultural, social, and behavior aspect of the patient may help in the optimal management of the pain. Then, according to homeopathic point of view, how we can manage the pain? Again, homeopathy is based on the individualization, and homeopathy, totality of the symptom is the foremost important thing in any case. But in the fast-moving times, spatial modulation is needed for keen understanding of any disease because it is almost impossible for a single physician to know and tackle all the cases and perceive the nature and progress of the illness. So conventional therapy has so many limitations in a pain management where the homeopathy can contribute a lot. So it's time that a special emphasis may be given in such pain cases, irrespective of the fact that absolute cure is possible or not. So for the treatment of any disease, analysis is needed in each cases and every case, but in that cases, a spatial reference must be given to the character of the pain in terms of location, sensation, modality, extension, nature of and intensity, associated symptom, and underlying pathological or psychological conditions. So depending on homeopathy, first we can go through the organon point. Organon point of view, what set us apart? Pain is the mind important here in cases. Pain can be matter of pathology, emotional trauma, bad luck, misfortune. Does it need much of circumstance as it is a local malady? Do we take a proper history or we need to just prescribe a specific medicine like arnica, vellus, hypericum, calendula, etc.? So depending on organon, in aphorism 138 of 5th edition of Organon of Medicine, Dr. Hahnemann sir said that all the suffering, that is accident, changes of health of the experiment during the action of medicine is essential, a good and pure experiment are compiled with, are solely derived from this medicine, and the must regarded registered as belonging peculiarity to this medicine as a symptom of this medicine, even through the experimenter had observed a considerable time previously. The spontaneous occurrence of similar phenomena in himself, the reappearance of this during the trial of the medicine only shows that this individual is by virtue of his peculiar constitution particularly disposed to have such symptoms excited in him. In these cases, they are the effect of the medicine. The symptoms are not arise spontaneously by the medicine that has been taken in a exercising and influence over the health of the whole system, but be produced by the medicine. Here, word accident doesn't taken as a physical accident. Accident can be a mental trauma or mental suffering or emotional variation, or that can be as we taken as a physical one. So we have to take this accident word on a mental plane and physical plane on both the plane. And aphorism number 139, he said, when the physician does not make the trial of the medicine on himself but gives it to another person, the latter must note down distinctly the sensation, suffering, accidental changes, and health and experiences at the time of their occurrence, mentioning the time after the ingestion of the drug when each symptom arouse and if last long the period, its duration. The physician looks over the report in presence of the experimenter immediately after the experiment is concluded, and if the trial lasts several days, he does this every day in order, while everything is still fresh in his memory, to question him about the exact nature of every one of the circumstances and to write down the more precise detail so elicited or to make such alteration as the experimenter may suggest. So he who makes known to medical world the result of such experiments become thereby responsible for the trustworthiness of the patient experimented on the his statements and justify so the will of the suffering humanity here at this step. So here we took the guideline from the drug proving area about the pain from master animal. In aphorism 256, it's also given some criteria regarding the pain. So what are the classification of the disease condition? Pain is not a disease. It is an important factor considered to be the symptom in each individual case. So whether it's an acute condition or chronic condition, if we go through the acute disease in aphorism 72, Dr. Hahnemann described the acute condition. It's always a less than 3-month pain. Than in a chronic one, in aphorism 78, it is more than 3 months to patient suffering as much as he suffers for years and years. That comes under the chronic disease conditions. So what is the miasm responsible for causing pain? Mostly we are observing the psorico-syphilitic changes in the body. And we have to note down the stage in which the disease is presented, intensity of the presentation of the pain, then progress and rate of the disease. So depending on that, we describe the type of pain in case of psora, psychotic, syphilitic, and tubercular miasm. So in psoric, there will be a neuralgic pain that is better by the rest, warmth, and worse by the motion. In psychotic one, rheumatic pain, psychosis are there, depositions are there. So rheumatic pain, osteoarthritic pain, that will be aggravated by cold dampness and better by moving and stretching. And syphilitic one, bone pains, there will be degenerative changes in a bone. Then the tubercular vein, there is a sense of great exhaustion, weakness, patient tired easily, never seems to get rested. Then it is aggravated by the sunrise and depending on the sunset. Then in psora, there will be psora, bruise, pressure pains. In case of psychotic joint pains, generally stitching, pulsating, wandering type of pain involving more than one joint. Then syphilitic pain, that is burning pain, bursting pain, tearing pain, like peripheral neuropathy or after the burn. Pains are mostly after the degenerative changes. There will be a burning and bursting and tearing type of pain in case of syphilitic degenerative miasm. Then some of the rubrics are given in a Kant repertory. As we know, pain is the largest rubric in case of Kant repertory. So some of the types of pain sensations are given. We have taken the few examples of the pain sensations that are given in a Kant repertory: aching, biting, boring, burning, burrowing, bursting, cramping, cutting, growing, dull pain, foreign body as if gnawing, grasping, grinding, grubbling, hacking, and jerking. These are the few examples of type of pain. Because knowing the exact etiology, we have to know the exact type of the pain that patient suffering with. So what is aching pain? Aching is the continuous dull pain. Dr. Kent has given this pain aching rubric in a various sections. In mind, it is given restlessness, medicine calcarea floor, vertigo, fullness aching, sympsyphuga, head pain. In a urinary organ, dysuria, prostate, urethra pain, genitalia. In male genitalia, female genitalia aching, medicine will be different. Back pain in a sacral region, Then extremities, cones, aching, then sleeplessness, sleepy all the day, sleepless all the night, body ache is all over. Medicine, single medicine given was staphylococcus. Then biting pain, biting a localized sharp pain of pinching and deeper burning. And it is also given in a head, ear pain, face eruptions, urinary organs, extremities, and in general. So various medicines are given under this each sections and each rubric. Next, the boring one, definition from outside to in, steady pain, continuous pain, boring pain. So it is observed in case of stitching, boring pain, ammonia, testis pain, boring, cilicia, plumbum, larynx, trachea, boring pain, coccus cacti, extremities, boring pain. Various medicine was given in that. Then burning pain, hot like a fire, like arsenic. So various medicine are also included with arsenic. Head pain, eye pain, abdominal pain. In case of urinary organs, burning pain, various medicine were given. Male genitalia, extremities. Then burrowing pain. It is mild and nagging pain. So head pain, ear pain, extremities. So various rubric are given in the sections and various medicines are described by Master Can. Then bursting pain, explosive, violent in character like belladonna, bursting, congestive, headache, painous. Then is head pain, inflammation, bursting pain like staphylococcus after the injury of the eye holes. Then male genitalia, pain, bursting, spermatic cord, kali, arsenicum. Cramping pain on and off in intensity, muscular like tired in a knot. So cramping sensation commonly observed in abdominal region, but it is also given in a head, in a male genitalia and extremity level. Then cutting pain, sharp knife-like cutting pain. So head pain, cutting sensation, then bladder, urinary organs, male genitalia, cutting pains, phosphoric acid. Then drawing pain, like pulling inwards, like lumbar metallicum, like sabina, like sickle cord. So head pain drawing preceded by drawing in armpit, like petroleum. And abdominal pain, cutting drawing in abdomen, single medicine was given, valeriana. Dull pain, that is constant, mild to moderate intensity. Head pain, jerking forehead, alternating dull pain, sternum metallicum, stomach, and with emptiness and dull pain, head restless. Then foreign body, as if sensation of something present that is not normally there. So foreign body sensation in right side of brain, single medicine given is conium. Then throat, internal pain, and sabadilla and valeriana. Knowing pain, intermittent intensity, annoying, chewing pain. So this head pain, then rectal pain, then grasping, squeezing, pulling sensation commonly observed in abdomen. It is also observed in case of head, gasping pain. So argentum nitricum, arsicum, conium, halibudus, magnesium muriaticum, natrum sulf. Then grinding definition involves the motion wearing smooth by the friction or motion. So mostly observe in head, abdomen, in extremities. In the head is given grinding, agaricus, anacardium, or myrica. Grumbling. What is grumbling? So it is chronic, changing, but constantly there, mild to moderate. And head grumbling, various medicine is given, indigo, hepa, sulfuric acid. Then hacking, cut, notch, slice, hacking pain. Then jerking pain, pain makes you move. Not a pain, it's like a something that happens in a body, mostly observed or complained by the patient at the night and mostly observed with the vitamin B12 or D3 deficiency. That's the single muscle twitch or leg jerking at the night without knowing to the patient. So it is also observed in a various part. Here we given the example of head pain, stitching, jerking. So natomule, Nux vomica, and pulsatilla will be the medicine for that. So these are the a few examples of various types of pain that persons are suffering and complaining to us. So let's move further with the some of the homeopathic therapeutics or some of the homeopathic medicines indicated for the pain. Anika montana, famous remedy for the tiredness after any family function or traveling. So indications are traumatic pain, bruising, soreness, and muscle ache after overexertion. Now, modalities we are observing that it is aggravated from touch and motion and better by lying down and with the cold application. So here we are giving the medicine on a therapeutic basis to relieve the acute condition of the patient. So it should be given in a lower potency and frequent doses. So here, that's why we indicated 36 potency and frequent doses. And if we are prescribing medicine for the chronic one, we have to take the emotional, pain, and behavior changes. And depending on depending on the susceptibility, we have to choose the potency of the medicine. Bryonia, stitching, tearing, was from the motion and better by the rest and pressure. It is aggravated by the slightest exertion and warmth. Then Rustox, famous remedy again for the stiffness, for the winter, for the rheumatoid arthritis, osteoarthritis. That type of pain will be aching pain, soreness, especially just improved by the motion. Now, we will observe that patient will aggravate with the first motion, and continuous motion will relieve the complaint, and warmth will relieve the complaint. Then the hypericum, nerve injury, mostly shooting, sharp pain, especially neuralgic pain after injury that is aggravated by cold touch motion and better by warmth and rest. Then magnesium phosphoricum, neuralgic pain, especially those are the spasmodic one and better by the heat and pressure and aggravated by cold and light touch. Then stephysagria, mostly indicated after the surgical one, post-surgical pain or after pain condition, after surgery, after labor, after LFCS. So pain after surgeries, especially incisional pain, neuralgic pain, better by the warmth and pressure. Then the aconite, sudden, intense pain, especially after exposure to cold, shock, heat, sun, with restlessness, anxiety, and fear is with us always associated with the pain. Next is the belladonna, throbbing, bursting, violent, congestive pain, especially in a headache or in a migraines that is aggravated from light, noise, touch, hair wash, haircut, jarring. Next is the coffea cruda, extreme intolerable pain, as we indicate this remedy in case of toothache. It comes under the trio of pain remedy by Nash. So oversensitive to all external stimuli, excessive mental activity, agitation, and restlessness. It is also indicated for sleeplessness. After the relevance of the pain of the coffea, with the coffea, patient feels sleepy. And that's why coffea cures the sleeplessness. Next, the arsenic album, burning pain, particularly useful in cancer pain, or also it is indicated in a burning pain due to the peripheral neuropathy, burning pain in the aged patient, especially on a lower limb and on a back. Modalities are restlessness, anxiety, and fear of death. It is mostly aggravated at the night. Next, nux vomica, pain from excessive drug use or overindulge in a stimulants. And patients are oversensitive to all other external impressions with irritability and angerness. Next is the nephilim, again a good medicine for the sciatica, that pain radius down the leg, specially indicated for the right-sided sciatica, as colocynth is indicated for left-sided sciatica. Nephilim is indicated for right-sided sciatica. And it is associated with the numbness, tingling sensation along with the pain. Then Eupatorium perforatum, we have given the marvelous result in case of post-chikungunya pain, post-viral arthropathy, with the help of Eupatorium perforatum. to remove this bone pain, especially in dengue fever, malaria, chikungunya, severe pain in a bone, like muscle soreness, bruise, swelling, or break bone fever like pain. Eupatorium is giving very good result in that. Then the Simsifuga racemosa, pain is associated with the menstrual cramps and rheumatism. Then painful menses, muscular soreness, and stiffness. Rheumatism alternate with the menstrual complaint that we are going to observe in case of Ecchia racemosa or Simsifuga racemosa. Next, causticum, pain due to muscle stiffness, joint deformity, burning pain, especially in muscles and tendons. It is also indicated for the trigeminal neuralgic pain, especially right-sided. Next, rhododendron, pain was before storm, especially in a rheumatic condition, pain in a joint that is aggravated by cold, wet weather. It is indicated for neuralgic pain, especially felt on a chest, tight neck, neuralgic pain, pooling in a chest. Rhododendron will give the very good results in case of this type of pain. Then a ruta, pain in the tendons, ligament, connective tissue, mostly after the injury or formation of the nodes or calcaneum in the joints, especially in the wrist joint and ankle joint. Then overstrain of the tendons and joint, bruise and soreness. Then cadmium sulf, great remedy to relieve the pain of the cancer patient after taking chemotherapy, radiotherapy also. It relieves the acidity and pain in the stomach, burning pain in the stomach, and vomiting after taking chemotherapy and radiotherapeutic drug, and relieves this pain that won't be relieved by taking various antacid, that is relieved with the help of cadmium sulf. Then conium maculatum, hard glandular swelling with this teaching pain. Conium is also indicated for various carcinomatous condition like carcinoma of the breast, carcinoma of the stomach, carcinoma of the various carcinomatous condition are observed in case of uterine carcinoma also and cervical carcinoma also. So it relieves the pain of cancer patient. So pain that is was at night and hard lumps in the gland, because there will be an involvement of the lymph node in case of conium, and conium having a very good affinity on the glandular pain. Then carbovegetalis, as it comes under the life-saving drug trio of homeopathy, it will relieve the burning pain, particularly when there is tendency to faintness, coldness, exhaustion, and weakness. Then the Diaspora billosa, indicated for a gallstone like colic pain, especially in abdomen, with belching, flatulence, and distension of the abdomen, which is relieved by bending backward. Then Kalika, stitching pain in the muscles, especially in a lower back. Now, person having a weakness, perspiration, anemic conditions, stiffness, and patient throws herself on a chair due to the severe back pain. Then natrum muriaticum, headache, bursting pain. It is good medicine for the migraine, sun headache, with nausea, with vomiting, with grief, with sadness, with stress, with brooding. So natrum is indicated for the chronic type of pain also, where you can find out the various behavior changes and psychological cause behind the pain. Then spigelia, throbbing, stabbing pain, especially in eye modality. That pain was from motion, touch, light. And it is also indicated for right-sided trigeminal neuralgia and right-sided migraine. So these are the homeopathic therapeutics. Now, what is Vascal? It is used to determine the level of the pain. Means there is no pain, minimal pain, mild one, moderate one, distressing one, intense one, and severe one. So depending on that, we will take the case, how much the intensity of pain is there, and in follow-up, we have to again mark a level of the pain of the patient, that how much pain is reduced depending on this gal to find out the improvement in a patient. So these are the few cases of the clinic. Mostly I'm seeing the cases where female is most common sufferer one, and age is more than menopausal age, and due to osteoarthritic changes or due to osteoporosis, they are suffering with the lower back pain and various type of disc herniation and spondylotic changes and lumbosacral pain, and associated with various GI complaints and psychological complaints with that. And various medicines are indicated depending on the associated symptom, depending on the type of pain, depending on the modality, as we homeopath individualize each and every case. So depending on the course, we have find out the specific suitable remedy for them and given that medicine to relieve this complaint. So these are the few cases of it. Thank you.
Really an excellent presentation from Dr. Vaidehi Bhatt. You deserve kudos from all, not only from those who attended the session, but also those people who are really interested in homeopathy. This is one of the very important area, pain and management, because this area we can do a lot of wonders, and a lot of people get results, and thereby they become the followers of homeopathy also. Yes, as you rightly point out, that this harmony to the
This
person,
disharmony to harmony, sir. This discomfort to harmony.
discomfort to harmony. That was the subject. Really, everyone enjoyed, and those who are interested in the discussion may come out with your audio or with your video, or you can raise your hand so that you can speak to or make your addition to the session. I think Dr. Kaushik Bhatt is there. Let us begin from Dr. Kaushik Bhatt, sir. So your audio is not connected. So what you have to do is you just leave the session and then rejoin. Then only you can speak. Your audio is not connected, so you cannot speak to us. But of course you can hear us. So let us go to our friend from Pakistan, Dr. Amir Malik is always waiting to talk, and let us.
Hello, Honorable Doctor. Good evening and
Good evening, sir.
namaskaram to all. Honorable Doctor, it's a special guest, Honorable Doctor Vadia. Maybe I'm speaking wrong. I'm taking your
Vaidehi,
name.
sir.
Yeah, Vadia Bhatt. God bless you, Honorable Doctor. It's an excellent lecture.
Thank you so
Yeah,
much, sir.
yep. I believe there are infinitive types of pains. Infinitive.
Yes.
And homeopathic medicine system is dealing with all kind of pain. And I'm really surprised why only the Panadol is selling in the world. The medicine should be sold by the homeopathic doctors. Second thing, Honorable Doctor, in my practice, I have found for the nerve lacerations and the quick pain management, there is
Yes.
the wild use of dopamine and GABA by the Western doctors.
Yes, sir.
That is acetylcholine and glutamic acid. I have,
Yes.
I just want to know in the alternative form in the homeopathic medicine system, what may be the alternate of dopamine and GABA? Number
Sir,
one.
gabapentin and dopamine is indicated in case of peripheral neuropathy, mostly
Yeah,
to relieve the burning pain in a aged patient or diabetic patient, or mostly in a female patient, because it
yeah,
is mostly seen with the B12 deficiency and nerve conduction problem. So if
yeah,
we are going to diagnose the case, we have the various medicine indicated for the burning pain, depending on the intensity and depending on the site and location and modality. So we have various medicine indicated for this neuropathic pain, like arnica, phosphorus. Simple sulfur is indicated for peripheral neuropathy, sir. That will also relieve the burning pain of the patient. So various medicines are available, and we can remove the side effect of this gabapectin also. If person
Yes.
is given this medicine, gabapentin, along with the methylcobalamin, B12
Very,
combination, and
very right.
the patients are suffering with the headache and lethargic one and sleepiness after taking it. They feel uneasy after taking it. Even still, they are complaining of the burning pain. Your burning pain is not relieved like acute one. Then this conventional system will suggest you have to take this for 1 month to 3 months to relieve your burning pain. So that things will be relieved with the homeopathy. Uh, and the side effect also will be removed with the homeopathy by stopping it. We can advise the food alternative to increase the B12 level of the individual. And with that also, we will prescribe our homeopathic medicine depending on the case to relieve this type of complaints.
It's excellent answer to the question. And now it's over to Dr. Bogley. Please unmute yourself.
Hello.
Yes.
That was a very good session by Dr. How do you pronounce the name again?
It's okay, sir. Thank you,
Ah,
sir.
Dr. What? Dr.
That
Wadahibak or uh, Wadahibak. Okay. You started with this phytopsychology, then you end up with all these remedy and the total symptoms regarding the pain. I think it is a very good info and insight for all of us, and also a good refreshing for us to in our daily case taking. I think I would like to mention specifically about this equatorium. I think it is a very good remedy for mosquito-borne diseases like chikungunya. I have even used it for prophylaxis and it works.
okay, sir.
Prophylaxis.
Yes.
Because there was a whole how to say it, whole village, and the neighbor has a chikungunya, and my friend who wanted the medicine, for prevention, he haven't got it yet. He's the only one who didn't get the disease among the whole row of houses there. So I think this you can look into the prophylaxis point for equatorium.
Yes, sir.
Okay.
Sir, we have given Eupatorium in, I guess, in 2017-18 chikungunya epidemic in Gujarat. We have used this Eupatorium perforatum as a prophylactic one, and after the development of it, we are usually prescribing Rustox to relieve the stiffness and post-arthritic pain. Now, still we have to prescribe intercurrent as a Eupatorium perforatum, then Rustox will give the results. So, Eupatorium having a marvelous effect on a chikungunya arthritic pain.
Okay, thank you very much. And what about the describe more about the burning pain in arsenicum album?
Sir, burning pain in arsenic is mostly aggravated at night. And what I have observed, it is mostly observed in a old age patient. And mostly it is on the cause of sciatic nerve. That person is always complaining with the burning pain like a curl, and they are usually using various kind of ointment to relieve that burning pain on an external basis, but that burning pain won't be relieved with the external one because it is caused by the nerve. And in some of the cases there will be involvement of the bone also with the osteoporotic changes, and that is observed after the age of 65 to 70 years. So while giving this gabapentin and methylcobalamin, that is the only option with conventional system of medicine, phosphorus and arsenic will give very good result in this type of conditions, and that will relieve the burning pain of patient.
Okay, that's very good. Thank you very much.
No,
Over to you, Dr. Dinesh.
yes, sir. Thank you. Thank you, Dr. Bogley. And there is a request to all, because some people are joining without their name or identity. So in those cases, we will have to remove you since there was somebody tried to hack our Zoom during sessions last week. So please join with your name. Otherwise, we will not be able to. You will not be able to attend the session. This is one request. Anyway, since some of the students joined today, I thought that let them enter, and we have to, of course, take a vigil on that. Anyway, nothing, no such bad incident happened. Thank you all. And now it is up to once again to Dr. Amir Malik to have a chat with you.
Hello, please wait a minute. There is a call disturbing. Please wait.
Yes, sir. We can't hear you. Oh, no.
Doctor, sorry, it's twicely I was DC due to the call on my WhatsApp. I'm sorry. Honorable Doctor, my question is how to rise dopamine, the alternate of that, because it's widely using to mood swings. And after major surgeries, it gave a bigger sports to the patients to have energy and nerves relaxation. In homeopathic medicines, which medicines act equally to dopamine and can give the same results? The psychopathic medicines, all psychopathic medicines, they are widely using dopamine. Either they are giving risp, they are giving alp, they are giving xanax. And what is the end thing which I found? The patient become relaxed, whatever the type of injury is. So what is the instant SOS, quick access? What I found, magnesium silicate have a very great result for
Okay,
the
sir.
pain. And second, pituitary. I found
Pituitary.
that it will help to rise the dopamine. But
Yes.
is any more another medicine which can give the fastest result equivalent to the dopamine input infusion? It is more than effective in
Sir,
homeopathic medicine.
I have observed the first is the in a psychopathic one,
Yep,
sepia, and then arsenic iodine having
yep.
a very good effect on this pain management and pain. Ars iode
Yep.
and
Wha-
Jesus.
And alternative of B6, what is that in homeopathy? Litharius
Sir,
or more than another?
B6. Well,
Yeah,
vitamin supplementation.
Yes.
yep.
Sir, vitamin supplementation. Sir, I'm following one of the great uh, nutritionist, that
Yep.
IT1 converted into nutritionist, and what he is saying, in our
Yep.
Indian diet there are
Yep.
many food stuff,
Yep.
then supplementation is ideally not needed of any of vitamins and all if we are taking proper diet in a proper amount and in proper timing with good sleep and good exercise. So
Yep.
ideally for me, no supplementation is needed if we are following our regular routine with regular dietary stuff. Yeah, supplementation is needed in case of person having a age and they are having a weaker digestive system. Then we have to advise them depending on their condition, and they can take some of the biochemic medicine as a part of supplementation to fulfill the minor amount of salt in our body. And mostly we are indicating Kali group, Kali force in a
Yep.
biochemic one to relieve the such condition and neurasthenic condition, exhaustion, nerve exhaustion, and pain. So
Okay.
Kali force giving a very good result in that.
Okay. Thank you very much,
That's
Dr.
great, Honorable Doctor. You please have another second session. You have selected a very, very good, in the RSA cases and
Okay,
trauma cases,
Dr.
homeopathic medicine is doing good.
Amit
You are
Malik,
giving an excellent session, Honorable Madam, Honorable Doctor. God bless you. A lot of praise for you.
also thanks
And
for
Thank you, sir.
and Indian recipes, we are love it. It's very famous in the world. We all love to have that such pure Ayurvedic Indian recipes. It's really, really, really great. My whole family always watch the recipes Indians, and we are using and cooking and frying and doing all at home. It's really great. We really
Thank
appreciate.
you so
Thank you
much,
very
sir.
much.
Yes,
Namaskaram to all, and
Yes,
God bless you.
Thank you. Tomorrow we will have a session from Dr. Sumana Kumari Pandey, and she will be talking about esophageal varices, a case of sulfur. You can, all of you can watch the same session tomorrow at the same time. It's over to Dr. Rambaresh to say vote of thanks to the session. Please unmute. Please unmute.
Thank you, Danesh. Congratulations,
Thank
Dr.
you, sir.
BHATT, Bhatt, madam.
Thank you, sir.
Excellent session. Very nice presentation, dynamic lectures, and all types of pain according to law of homeopathic science. Mathematical angle, chora, psychotic, and syphilitic pain, and every medicine deals the kinds of pain. So very, very thanks. I am very agree.
Thank you.
Dr. BHATT, Bhatt, behalf of IFPH, very, very thanks. Again, presentation, IFPH. Thank you very much.
Thank you so much, sir. Thank you, sir.
Thank you, Dr. Vaidehi Bhatt, and those who attended the session. I hope all of you will be joining us tomorrow at the same time. Thank you all. Good night.
Thank you so much, sir.
It's over to Dr. Mariamma John to moderate our Malayalam session.